This is the Barbell Therapy and Performance Podcast, where traditional healthcare is redefined to help listeners achieve peak performance, accelerate recovery, and elevate overall health. Hosted by Dr. Brett Scott, a doctor of physical therapy and national strength coach, this podcast explores the worlds of fitness, alternative medicine, and holistic health. Each episode uncovers innovative strategies and practical solutions for those seeking to enhance their quality of life when conventional methods fall short. It is our firm belief that every living thing has potential, and it is our mission to help you find that potential.
All right, everybody, welcome back for another episode of the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today is Miguel Aragoncillo. He is a strength coach, licensed massage therapist, and also trained through Postural Restoration Institute. He's been a speaker at various various strength and conditioning conferences, and he's also the former strength coach for the New England Revolution and the Red Sox. So, Miguel, thanks for coming on today. I appreciate you taking the time to do this. And what I really wanted to talk today with you about is your experience being a postural restoration practitioner as well as strength coach, and how you've applied those things into the realm of baseball, which has kind of become one of the main specialties you have as a coach. And you've done some interesting presentations on these for like sprinting and pitching. So I want to really talk about that today and what PRI looks like, because it's mainly about breathing, and breathing is such an important thing. And we talk about it with our patients all the time, and they don't always really understand the importance of breathing and the dynamics of breathing. So from your perspective, what is PRI all about, and kind of what lenses are you looking at that through?
For sure. And before I even answer that question, I just want to address, I know, a lot of different individuals listen to this. At its simplest, it's not like I'm the only strength coach at the various organizations. It's like a whole team. So I don't want to downplay anybody else's role, is kind of what I wanted to start with. It's just like a big team, support staff, if you will. So I was one of the support staff. Mm-hmm. So anyway, to answer your question, what lens am I looking through strength conditioning with PRI? It's interesting because at its simplest, Postural Restoration Institute takes a lot of different facets of neuroscience, if you will. It's not just, hey, we're going to do balloon breathing, and then you kind of go into your lift afterwards. Because that seems to be the mainstream thought process, right? You kind of think of like big name brands, like, okay, McDonald's, you got Burger King, you got all these different types of like brands, and then the things that come with it, right? From Postural Restoration Institute, I don't really hear people say, oh, what are you doing with this neurologically feed-forward technique? That question never really happens, because that's technically what's actually happening. Is there are a lot of different things that occur from a neural level, and that's the lens that I look at it from my strength conditioning perspective. I use those words specifically because I'm saying if there is a way to neurologically, we'll even say enhance or even lay the foundation for an individual's, I'll even say patterns, that can only help in their lifts, in their sprinting, in their athletic movements, in whatever movement that may be. So it's not just saying everybody needs to do PRI and then you automatically get a big contract. Right? That's kind of not how it works. Essentially, it comes down to how can you, the athlete, maximize your foundation. Okay, because from a neurological level, and this is a whole bunch of different acronyms and thought processes and philosophies, fundamentally, like even when we are living quite literally in, if I use the right terms, I'm stepping outside my lane, in utero, like in the belly, mm-hmm. like you're developing patterns. Like these things are genetically hardwired. Now, what is something that's more softer is how you develop afterwards. And thus, PRI can begin in the context of funneling all of these different research and different philosophies from a neurological level, and then saying, oh, we can use techniques to help restore patterns. So I took like a 20 million foot perspective, and then I kind of brought it down to like how can I use it? There's different techniques that will help individuals essentially move better. And then from that part, it's like, oh, now you can train. Now you can exercise. And I don't want to say I'm gatekeeping, but that's kind of where I'm at with respect to how I use PRI, not just from an athletic perspective, but just from like an everyday person perspective.
Mm-hmm. And I think one thing too we need to kind of clarify for people is when we're talking about posture here through this, posture is a dynamic thing. It's not just the way you sit in your chair or you stand upright. It's how you can get into different positions, how you are posturing through life, movement, sport, and all that, correct?
Mm-hmm.
And that's kind of the lens we need to look at that through. So,
for sure, yeah, and that's a whole other topic altogether. I'm sure there's a whole, rabbit hole of people discussing what good posture is, what not good posture is, and every social media post that does those X's and checks on this is good, this is bad. Mm-hmm. So I'm sure we could talk forever about that.
Yeah. So for the layperson like me that might have some idea of this stuff, why is the rib cage and breathing so much more important than people kind of believe it to be? Because we can tell people, hey, we need to fix your breathing. It's like, I'm here, I'm alive, I'm breathing, but what's below the surface of that?
Right. So, the rib cage is not just a static bone in your body that does not move. It's there for evolutionary purposes, and the concept of how the rib cage even kind of came about is interesting on its own. With respect to training, with respect to just breathing itself, the simplest thing that I can have in terms of discussions for, if I'm talking to a client, I ask them how you breathe, and then, they might not have any answers. Like, I just breathe. Totally fine. Then I try to explain, well, there's prime muscles that help with breathing, and then there's accessory muscles that help with breathing. Like, if every breath you take, whether or not it's from 18 to 20 something thousand breaths in one day, if all your breath comes from your neck and you go, that's like every breath you take, you're using your neck muscles. Probably not the prime muscles you want to assist for many reasons, but at the same time, your neck muscles don't 100% help you pull in air to your lungs. And then we could start talking about gas exchange. We could talk about all these different things. But more importantly, if your neck is an accessory muscle and there's other accessory muscles that may be utilized, what are the prime muscles that should be helping and assisting with breathing? And then we could start talking about the diaphragm. We could start talking about the internal, external obliques. We could start talking about pelvic floor. We could start talking about those things and how that plays into how important it is versus, some of the other things of like, yoga, belly breathing. So those are, I kind of mentioned like 6 different topics all at once, but that's kind of why I think, rib cage and breathing appropriately will be beneficial to a lot of things, not just from a purely muscular level, but from a neurological level as well. Because at its simplest, right, if I kind of use the phrase, I want you to use box breathing. I want you to inhale for 4, exhale for 4, then you're going to pause for 4, and then you're going to re-inhale again. So even if you just mentally go through that process, while you're driving to work, when you're getting ready to wind down at the end of the day, simply probably helps you, even just a little bit. So is that at surface level, is that it? Is that all PRI is? And I'd say no.
Mm-hmm. So yeah, one of my mentors, and I'm not going to mention who, but he has said PRI has people going down too many different rabbit holes, and that breathing in itself, like you just kind of mentioned, can be something that can be very beneficial. We can see changes in mobility and tone just from some simple breathing sometimes. But he always said, I bet you could see the same improvements doing all these crazy exercises completely backwards if you just focus on the breathing more. So what is your response to that?
Of course. And, I think the research is well, there's a lot of research speaking about, focusing on the meditative aspects of breathing and all those things that come with it, right? Reducing anxiety, improving gas exchange. I mentioned that earlier, that sort of thing. Just the mentality side of things, right? And then from that, you get this autonomic effect of total body relaxation to some degree, right? Mm-hmm. other than the actual stretching in yoga class, like if you just went to a yoga class just for breathing, you probably feel pretty good, right? But I'm thinking more along the lines of, when was the last time somebody took 1 hour for themselves and they are previously a very busy individual, and you said, hey, I just want you to go to one class and just like relax and breathe? They probably feel pretty good afterwards, because their 24 hours is pretty hectic, right? For the average, listener, it might be like, start your day this time, this, and you have kids and you have work, and then I force you to do one yoga class of just breathing. You'd probably feel pretty good. So I can't deny that benefit, right? The autonomic effect of literally just relaxing. However, there might be some things from a musculoskeletal perspective that may be more beneficial. There are a lot of techniques that focus on breathing within Postural Restoration Institute. And then there are other techniques that don't focus on breathing. And I kind of alluded to it earlier when I was mentioning some of the words of like, this is a feed forward technique, this is a feedback technique. It's a little bit nuanced, because it's like, well, what does it matter? How does that even play into breathing? I mentioned those things because if there is, for example, an individual with a tight hip, how can an individual simply just breathe away a hip problem? And then that question doesn't necessarily get answered. If somebody says, hey, I have a neck problem, specifically a neck problem, you could do some breathing, but again, that same question of, okay, your neck is accessory movers of breathing. If we just enhance the prime movers of breathing, you'll be able to maybe get some benefit out of that. But is your neck better or worse? And then there are some different things that we can address from neck inhibition techniques. With that hip problem, there may be some hip inhibition techniques that we might need to use. So once you start, there's that level, that surface level of question, which is totally fine to have. Just focus on breathing more. What's the harm? Go ahead and do that. Like, nothing wrong with that. I'm not going to be the person to stop somebody from trying a yoga class just to relax, right? Why would I stop somebody trying that? At the same time, if somebody needs a hip stretch specifically, how do you know that person needs it without properly seeing them and assessing them and then going through the motions of like, here's my clinical checklist of the things that I need to do? And then we can start talking more scientifically, not even within the context of PRI, but it's like from a scientific thought process. Is this where what am I seeing? What am I observing? Here's my thought process. Here's my solution. Did it work? Like, go through that thought process and see how things change. And if you use that thought process, you can start to see, like, even if I didn't believe that a hip capsule stretch should not work, if you do it anyway and it does work, well, that goes against your thought process, but it still works. Mm-hmm. That's science.
Yep. True. All right. So then you did this presentation for the Interdisciplinary Studies Summit about the application of a PRI framework to pitching and sprinting. So can you tell us a little bit about what that entailed?
For sure. And this kind of builds on that thought process of, this is not just a thought process or framework in this case of breathing only techniques. So to take one step back, in your clinical practice or any other physical therapist, or even just if you're a keen strength coach, you can see how somebody runs. You can see how somebody walks. You can see how individuals come into your facility or clinic, and from just a pure watching them gait analysis, getting out of the car, you're like, oh, this person might have a hip thing. This person might have a knee thing. This person might have a XYZ thing, right? So with that thought process of just simply observation, there is this thought process of, okay, here's gait analysis. There is a course in Postural Restoration Institute. It's called Forward Locomotor Movement. Long story short, it's a very high-level way of looking at gait analysis. There's different phases of gait that everyone should theoretically be familiar with from a clinical perspective. But in this case, there's a lot of different other steps involved. So I took that and I said, maybe I can apply it to pitching. and sprinting. Because if I can apply these steps to an athletic movement, I can provide some level of value to any organization or even in just my own clinical practice. Because that's kind of what I wanted to do. We were already doing these things, or we as in the collective sports medicine world. But now here's a framework that can help individuals identify key things without the necessity of utilizing motion capture, without utilizing $60,000 cameras to see 4,000 frames a second of how somebody pitches. Because now you can just kind of eyeball it to some degree and say, wow, this person is not getting this motion. Here are techniques now that we can do to regain these things. So a popular thing in pitching that's gained some traction over the past, say, few years, if not 5-6 years, is this thing called scap retraction. And it's not too unknown to anyone who's even worked with one baseball player. Essentially, it's the ability for your scapula to move towards the middle of your spine and for your arm to just come backwards. Long story short, that's called horizontal abduction. Okay? There's been a bevy of exercises that claim to improve that, whether it's weighted balls, different stretches, manual therapy. But at its simplest, it's like it should not take, in my eyes, in my estimation, and in my experience, it should not take more than, if somebody's doing this for 12 weeks just to gain 5 degrees of horizontal abduction, kind of barking up the wrong tree. All right. So that's kind of what I'm saying. This is an application of a PRI framework to pitching, because that horizontal abduction restoration, your arm going backwards behind you, as if you were trying to reach for a seatbelt, for example, or just turn around. Somebody's calling your name. You want to turn around. There's a combination of rotation, if I'm going to my right, if I'm a right-handed pitcher, and then my arm coming backwards behind me. That on its own should be fairly easy for anyone who's taken a handful of posture restoration courses. So this is kind of what I wanted to suggest through this presentation. Here's my application on a high level, not even just like I'm going to work with, Johnny, who's 12 years old, just started playing baseball. This is my work with individuals who are trying to almost throw 100. I've worked with individuals that have gone from 90 to 95. They've already hit 95, but then once you start chasing that velo monster, it's like things, screws start falling off, and then you get tight, because that's how kind of it works. You start pushing all limits, things get tight. And because of that, if you use even 1 or 2 techniques to improve how that arm works, how your stride leg works, how your landing works, you can improve quite a bit with a little amount of effort. And that's just efficiency on its own. Mm-hmm. So long story short, that's kind of how I looked at it, and I wanted to help individuals understand it from a pitching and also a sprinting perspective. I worked with some NFL hopefuls, some working on their pro day combines. So
what are some of the things we see with these rotational type athletes that are common faults that we can easily correct with PRI?
Right. I kind of alluded to a few of them, whether they're overhead athletes or just, all athletes in some sense, they will rotate unless you happen to maybe be, an Olympic weightlifting athlete, right? That's purely sagittal. Powerlifting athlete, purely sagittal, right? Yeah. So I powerlifted as well, right? So it's pretty straightforward. If things start to rotate when you're doing a sagittally based sport, that's when SOL. Hope for the best there. However, just about everybody else, even track athletes, a lot of big named sprinting industry leaders, they say sprinting and running are rotational because there's rotary components part of that. It's not just like you're walking down, the track in a kind of a tin man kind of walk or sprint. You have to rotate to get that force. I think, we kind of went over some of the questions prior to this. I think a big thing that I see in athletes, just athletes abroad, just generally, I'm never really going to see some individuals that are like, man, your obliques are very, very strong. Or, man, your lats need more strength, right? It's not really like you're very weak in the prime movers that you should be good at. And if that's the case, that's when like, something's going on, flashlight, right? Or light bulb, something's going on. Then I start to think there's other things awry. In this case, right, there's common patterns. It will just say in rotary, whether it's hitting, pitching, even sprinting, right, running. I think the good common patterns are a lot of oblique patterning should be occurring in the context of the abdominals. There should be a lot of, we'll even say PNF-like patterns should be occurring during these things, and maybe not even just so nuanced, but diagonal patterns. Okay, to relate it to gym techniques and movements, it would be akin to doing like a step up and then having your arm come across at the same time while you're holding one weight in the other hand, or something of that nature. Or maybe doing a step through on a cable row. Right? Instead of just rowing, you're actually rotating as you row, something along those lines. So improving the diagonal patterning is what I'm talking about in the gym, right? Those are common patterns. In terms of the dysfunctional, if I can use that phrase, dysfunctional patterns, there's all the things that create this sagittally based monster, if you will. Lat dominance, back dominance, right? How many people, PTs, not even just yourself, how many individuals have a clinical practice just on seeing, I have 80% back pain patients? Mm-hmm. That is a thing. Yep. So it's like, I'm never saying, wow, your back needs to be stronger. And then you start doing back extensions to help that. Like that doesn't necessarily happen, at least in my experience. That could happen in others for many different reasons, but that's not usually my experience. So, that sagittally based thing kind of comes up quite a bit, right? Rectus abdominis patterning happens. In baseball, there's been a handful of end of the year playoff wise, like oblique strains that take people out for however many weeks. And that's never fun, obviously, because imagine how hard it is to rehab an oblique. You use it every day when you breathe. Yep.
I think I strained mine, actually, and it's been, like, quite a time. Also, yeah, adding to what you say, like, thinking about it now, I think I've done, like, direct low back strengthening for low back pain, like, maybe twice in my clinical practice. Like, I don't do a lot of it, and people think it's something we do, but really, the only time I've really done like low back strengthening is with my weightlifters that are in a position where we just see the low back get smoked because of the frequency and intensity that's piled up there. And it's like, okay, we have a capacity issue sometimes, not nearly all the time, though, at all. So
right. And I don't even, we can make exceptions to every rule.
Yeah.
But that's kind of what, my experience is.
Same. Yeah. Okay. And so, what are there certain things that are, so we have all these different patterns. How is this limiting them really from a performance standpoint? Is it causing injury? Is it slowing them down from pitching or sprinting at a certain velocity? Like, what are these faults doing?
So, I'm going to talk more from like a pitching and baseball perspective, because that's kind of what I know. It's not necessarily going to just like prevent an injury, right? I think that phrase is a little too far gone at this point. Very social media-esque, like do these exercises to prevent injury. It's like, okay, I'm going to do them. And then they still get hurt. So the things that I kind of want to talk about are the reduction from a percentage aspect, if you will. For example, if an athlete, we'll say pitcher, for example, lacks external rotation in their shoulder, there could be so many different reasons for it, and it's kind of difficult to kind of outline these pieces. But at its simplest, if there's a lack of external rotation in their throwing arm, the forces simply have to go somewhere else. They have to use something to throw the ball, and 9 times out of 10, or whatever the exact percentage may be, it might go to their elbow. And then we have a whole bevy of elbow, injuries that can occur as a result of this. So that could be limiting from a performance standpoint, right? If the traditional motions that your sport asks for does not, you do not have it as the athlete, something along that kinetic chain has to make up for it or bear the brunt of that load. So, we're not even talking about PRI at this point. We're just talking about, hey, let's gain range of motion. So how do we gain range of motion? Well, you kind of go through all the modalities that I've seen and witnessed firsthand, or in my estimation, again, I'm just kind of leaning on it because this is what I know. We can speak on the efficiency of different techniques. If I can gain not just external rotation, but also shoulder flexion back in 3 or 4 techniques, I'm going to do it. 3 or 4 techniques without 100% of the explanation that may be occurring in like a one-on-one session probably takes at most 15, 20 minutes, at the least 10 minutes, right? If we do a different lat stretch, we do certain breathing techniques, and then we work on things to improve on how the ribcage moves, how the serratus moves, we can gain back that patterning. So that's kind of what I'm saying. And I say that so nonchalantly because I've seen it happen a handful of times. So it's not a surprise to me that if you gain range of motion back, you're going to improve your performance. Now, the question of whether this individual can accept that new pattern or restored pattern, not new pattern, but their pattern has been restored. I wouldn't necessarily say to them, now I want you to try 100% of your max effort of whatever may be. You're pitching, you're sprinting, you're lifting. You kind of have to ease into it to kind of let the brain reconfigure and calibrate where your body's at, right? This is why individuals more or less take time after a very small injury, if you will, soft tissue injury, etc. They take, okay, I have to take a 4-week break, go through rehab, and then come back and ramp up is kind of the traditional thought process. Now, this is where my thought process, what has not been 100% been vetted, because at its simplest, like I don't know any other individuals that are utilizing PRI at a high level for professional athletes that have quite a bit of a contract behind their name. So I've used it, but I have not seen like, okay, this guy has an elbow injury. Let's have Miguel work with this individual solely. It's usually a team effort is kind of what it is, right? We kind of take all aspects and take those things into account. And then I might pitch in 1 or 2 exercises, techniques as a way to kind of filter that in. So that's kind of my role in that area.
And so as a massage therapist too, and a strength coach, right? How much, I assume there's some like PRI purists that are only about breathing and things, or is it?
Yeah. Oh yeah.
So, what is your view on that? Of like, okay, we just had, or maybe we're looking at a potential future Tommy John surgery if we don't correct this person's throw mechanics, right? Because their shoulder doesn't move. Are there times when you will assess someone and be like, this tissue is truly stiff for whatever reason, and work pecs, rotators, everything else, capsule stuff, and not integrate breathing because it's not the issue? Or
I see what you're saying.
Yeah.
So yeah, that's if we're talking just, we're having a round table with all the staff and we're like, how can we, one, prevent any issues from popping up for anyone? And then if there's anybody that's at a critical threshold, right? Sometimes he has elbow stuff, sometimes he doesn't. That kind of question comes into play. So it's sort of like you're basically strategizing, you're creating a plan A, B, C, D, etc. So in that case, right, if I'm looking at it from like a departmental perspective, I'm trying to understand what are the outliers in terms of like their metrics, if you will. Then we go into what is their hand grip strength, what is their shoulder ER, IR strength based off of whatever machines we're using. There's a lot of different tech that's being used nowadays. But, you mentioned my background with massage work. At its simplest, we can still do manual muscle testing. That is still a thing. And we could start to understand what things might be more dominant and what things might be more weak. And yes, manual therapy and manual muscle testing, that's been up and down in terms of, is it effective? Is it not effective? Well, I'm saying let's use everything to make sure that we don't miss anything. Okay. So if somebody has, I just finished up my master's in sports science as well. And this is one of the research articles. Literally, This one article speaks about professional baseball athletes and how their grip strength improved through the season, even though they were still injured. So it's like, okay, you have an athlete that they are injured, but they have a very high grip strength compared to the non-injured athletes with a lower grip strength. So I see this look of confusion, and I read this as well, and I was like, I'm kind of confused as to why this is. And we can make some postulations, but this was just an observation that this paper did. Do some digging, and if anybody does any digging, you can see exactly what this paper talks about, what team it is, and it's like, this goes against everything that everybody thought. And this is with professional athletes, right? So with that being said, I'm sure we're trying to cover all the pieces here, if you will, to prevent anything falling through the cracks. So again, using tech, sure. Using manual muscle testing in some regards to the hand, pronators, supinators, flexors of the arm, even the rotator cuff muscles. Yes, let's do all that. And then, can we address these things from a PRI perspective and see what changes? Mm-hmm. See what changes after we utilize breathing techniques. See what changes, what happens after we do different inhibition techniques. Mm-hmm. Because for all intents and purposes, those athletes that were injured, they should not have a stronger grip strength. That might be higher because that's the only thing they have in terms of performance. Because they certainly could not perform at a high level if they're injured. But if this is the only thing you have, this is all you're going to use. So that's my thought process on reading that paper. But that's just an interesting aside.
Yeah, and so do you think not everyone needs PRI and certain people fall into the patterns? It's like I've seen myself, like I had a patient that had bilateral hip dysplasia surgery, and before we even got him a diagnosis of that, he felt like his upper and lower were dissociated from one another, and he felt like he had this weird posture, and he kind of did, and he had some adaptations, and he started having all these hamstring and glute issues, and it was like, as soon as I found him a PRI practitioner, like things changed immediately for him. And there's some people I see, I'm like, man, I think PRI would work really well for this person. But is it for everyone? Or is it something everyone should be looking into doing?
For sure. And, with the advent of the internet, there's definitely more information out now than there even was maybe 6 years ago, right? Pre-COVID, I bet everybody was, after COVID, everybody was like looking things up online and like, oh, look at this thing called breathing. I don't need somebody in person to do it, right? So that kind of helps everybody out in that regards. So to answer that question of, does everyone need PRI? There are more individuals that might have more predispositions to needing PRI. And I'm saying more neurologically based individuals. And then there's a whole list of neurological things that could occur. Even at its simplest, it might even be, like I mentioned earlier, anxiety in some level. There might be some level of shortness of breath, little things like that. We'll even just say back pain, just because that's probably what more individuals would probably try to improve upon. Because it's pretty simple to see, okay, your back is really tight. What's the opposite of your back? It's the front. Are you using your front muscles as best you can? It's like, okay, maybe that's an easy sell, is what I'm saying. Mm-hmm. It's a little bit harder to sell when it's like, hey, your eyes are not working together well. You need to go see a PRI practitioner. That's a harder sell, but it's more inclined to work in that manner because neurologically, your eyes have a big stakehold in your posture. Okay? If somebody has vestibular issues, might be a good candidate for Postural Restoration Institute things. Because if somebody has, and I believe we're both in Massachusetts, we see more black ice as a result versus somebody in California, for example, or Florida. So we have balance issues sometimes, slips and falls, right? And then because of that, we might have guarding. There might be guarding after, if that makes sense. So these different things can be addressed from a balance perspective, from a neurological perspective, with Postural Restoration Institute to simply help their individuals help themselves to trust their bodies after said injuries. I think to answer the flip side of that question, are there commonalities in things that won't be helpful from PRI? I think you asked part of that.
Kind of, yeah.
I would say, the hard part immediately is like post-op, right? Because you need some orthopedic things after post-op. You simply need range of motion, right? At the knee, you need full knee extension. If you don't have full knee extension, it's a little harder to get back, just from a pure healing perspective, okay? I think that makes sense. Post-op, immediately after like fusions, it's a little harder to do these things. You just need some level of healing and restoration. I think that just is a standard for everybody.
Yeah.
Elbow extension. So yeah, go ahead.
I'm curious about, so someone like myself, so I have ankylosing spondylitis. Are you familiar with that?
I'm familiar with the name, not like how it affects you.
It's a rheumatoid condition. So basically, it's my spine is supposed to be fusing over time. Luckily, I don't. But I do have, my body makes more TNF or tumor necrosis factor, which causes stiffness in the tissue. So, and I do have, I don't know if it's from being a rotational athlete as a kid, whatever too, but I lack left thoracic rotation significantly more. But I'm also I think my tissue is very stiff. Like anytime anyone goes to palpate me, it's stiff. It's hard to get that. So I'm curious for someone like me though, but then I've also like recently in the past year or two, I found myself, I have a high umbilical hernia or diastasis recti actually.
Yeah.
And then I had like a groin strain and a possible like oblique thing going on. So I'm like, is there a PRI component for someone like me that's stiff, but also is trying to still compete in an avidly somewhat high level?
Right. Nobody's getting younger, right? So
yeah.
The things that come with that, right? The things that stand out are, you mentioned stiffness, the quality of not just your joints, but how your muscles feel. I try to explain this to whenever I talk to clients, like what's the easiest connection from your muscles to your brain? And it's your nerves. So nerves, aka the nervous system, if we can attenuate it or reduce how intense you need to move, or rather your resting posture, if I can use that phrase, if I can help that part out and reduce the amount of tension that you are currently feeling, and not just by you listening to my voice, but by actually giving you different techniques to do so, whether it's breathing, whether it's otherwise, that is the thing that I'm going to use. So I'm trying to just kind of talk about the concept of, I'm agnostic to the method. I just want you to have some level of relief, if I was seeing you as a patient. So in that case, I want to help the nerves that attach to your muscles. I want to help them be not as intense, be not as necessary. Because at resting posture, you shouldn't have to be bracing your midsection. You shouldn't have to have a diastasis recti while you're just sitting there. Like you shouldn't just physically see your umbilicus move forward towards the camera, right? Yeah. So there should be other muscles that are being utilized. And same discussion again, right? Not just your neck being used as a breathing mechanism or as the prime mover, but now it's your rectus abdominis. You have other muscles that should be utilized. And I think, leading to it, it's not just your abdominals as well. There may be, you mentioned you have a groin issue or a groin pull, groin strain.
Yeah. And
that speaks to that pelvic floor. Right? So the most interesting thing, I know we had a question about, is there a link? I'm asking the question, is there a link between, pelvic floor dysfunction and PRI? And I'd say yes. Everybody has a pelvic floor.
This baffles guys still. I talk to guys all the time like, wait, I have one of those too. I'm like, yeah, we all have a floor.
Right.
It's not a bottomless thing.
Right. And it's more, it's again like one of those, is it common knowledge? It's like probably not. It's more associated again with pelvic floor PTs, women's health, etc. But it's like I've seen my fair share of patients that have had, and they were males, pelvic floor tightness. And it was really surprising. First couple times I'm like, this is interesting. Probably because they were, it comes with the emotional aspect and baggage of going to a female PT to help them with their pelvic floor problem. So they saw me instead. That makes sense. So it's like these things do have a relationship.
So I'm curious here for my own knowledge. As a PRI practitioner, what are you doing to assess a male's pelvic floor?
Right. And that question alone, that could be a sound clip right there, right? The thing that we do as PRI practitioners, there's a handful of assessments that we would utilize to indirectly identify whether or not an individual has pelvic floor tightness. It's not exactly internal work, for example. No thumbs are going anywhere. Okay. I think that just has to be said. Yeah. So indirectly, we could even just understand it as, okay, what does your range of motion look like in your hips? Okay. What does your straight leg raise look like? Can you touch your toes? Can you do a squat? Those are like the easier things to kind of like understand. Like if I was to ask anyone off the street, if you have a lower body issue and you go to a physical therapist, what would you expect them to do? And then they'd probably say, look at how this range of motion is. Just not even use those words, but like see what I can do mobility wise. But there's more specific things. We can look at it from, to use a less specific word, less nuanced phrase, it's hip circumduction. So I'm going to do it first passively, and then you're going to do it actively. Do they match? Do you use your back first? Can you even get to that range of motion without my assistance? That's one aspect. Then we're also looking at frontal plane, not just transverse, because hip circumduction, aka like a hip circle, that's transverse. Hip in the frontal plane, can your leg come up all the way while I'm holding your hip in place? We're looking at your ability for your leg bone to move within your hip joint. And then there's other aspects of, stance and gait that we'll look at as well. So looking at all those pieces, that's the specific assessments that I'd look at. There's a handful of other ones, but those are the first main common ones that I'd look at. And then based off of your presentation and your symptoms and your background, etc., hopefully the normal things that people ask during clinical sessions, then we would say, okay, yes, there is some pelvic issues. Let's do these techniques to help that. Then I would explain one last piece is your diaphragm, right underneath your rib cage. So that rib cage thing we were talking about, your diaphragm has to pull down as you inhale. So as you pull down, your pelvic floor also has to go downwards. It doesn't just stay up. So your pelvic floor is a composite of different muscles within you. And then because it goes down, that allows you and all the things within you, like stomach, intestines, etc., to come downwards as well. If your pelvic floor cannot move, you're going to have issues breathing. You're going to have issues range of motion wise. And that's basically the first 5-10 minutes of what I would talk about with somebody who comes to me with a pelvic floor issue.
Interesting. Because maybe I'll come to you if you're staying in Massachusetts, man. I'd be curious to see what the blending of what you do with PRI for someone like me looks like. And so outside of that, how do you find yourself blending PRI into your strength and conditioning practice? So you're working with high-level athletes or even avid,
Sure.
I work with a lot of 30-year-old has-beens that still want to stay fit. What things would these different people try to do to maintain or restore their posture?
Right. I think I recall, the fact that a lot of individuals listening to this, they may not be the highest level athlete, which is totally fine. If individuals are just trying to get ready to run maybe a half marathon, right? We're in Boston. I see that a lot. I have seen that a lot. Maybe the half before the full marathon, or even just a 5K, right? So those things, they have a lot of the end goal, and the way that I would get to end goal. There's a lot of practice in the context of getting PRI, utilizing strength conditioning, and then getting to that end goal. So I think it's a fairly, at least for me, it's fairly seamless. So first, I guess you could say the way that I would look at it is basically the way that I would look at those things from a pelvic floor issue that I described earlier. look at the background, look at the history, do a full body assessment, essentially. And then obviously ask them what their end goal is. That's kind of the biggest piece, because I'm not just going to go take you through my thought process and not address the main thing that you're here for. Then, if there's a need, we'll go through different postural restoration techniques that I believe will be helpful towards your goal. And the thing that I see quite often, and I'm just going to be speaking to runners, right? Because, runners are rotational athletes. You need to rotate in order to run. A thing that I've seen quite a bit, and I've worked clinically with Boston marathoners, and fun fact, I've worked with an individual who wanted to win the Boston Marathon. Like, I first saw him. I first saw him. He wanted to be All-American, and you can Google this. This is pretty straightforward. He came to me. He said, "Yeah, I want to win the Boston Marathon," and I was like, "I don't really know what that means." But he started outlining, his background. He was a collegiate runner, and he's moved up here since, and basically before work. So he does a 9 to 5. Every morning he would run a half marathon, like literally every morning, and then after work he would run 7 more miles. So every day he ran 20 miles, at least in the highest. So it sounds painful, right? But at its simplest, I mean, this is his life. This is what he's done forever. He does it well under 2 hours as a half marathon, because I think he did it in like an hour and change. It was like easy work for him. That's like me going through a lift in an hour. He does that in 13 miles. So anyway, long story short, he came to me. He said, "Yes, I want to win the Boston Marathon." And with accumulation of volume, you're going to have things pop up. Right? That's just a simple thing. This answers a lot of the questions you asked me earlier. What are the common things you'll see from a musculoskeletal perspective? Again, it's not like, hey, you have really good plantar fascia, you have really good calf resiliency. It's like they're going to get beat up, especially with that volume. So from a manual perspective, that's kind of what I worked on. But from a PRI perspective, I wanted to make it more efficient for his body to load. So we were doing the traditional things you might see online. We were doing this thing called a 90-90 hip shift to teach him to move in and out of his hips. Because when you run, guess what you do? You move in and out of your hips. So hopefully that link makes sense for everyday runners. Like, you don't necessarily need to back squat 2 times body weight in order to run a marathon. You just need to learn how to use your body efficiently. That's what I hope to bring to the table at the end of this podcast, at the end of the day. So by being more efficient, then it's like, okay, now we can actually use strength conditioning to help build the robustness and resiliency of the muscles, of the tendons, of all the things that come along with that. So we might do a 90-90 hip shift. We might do some different breathing techniques. We might do a standing technique on one leg to help you out, to help you understand what balance actually means. And then let's do a strength conditioning program on top of that. We'll do the one leg RDLs. We'll do the calf isometrics. Let's do the different planks and side planks, etc. Because now your body's moving more efficiently. You're actually using your obliques and not your rectus abdominis, right? You're not using your back for different techniques, different movements. You're actually using your arms to move when you run, which is maybe not so thought. Not many individuals think about that. You have arm swing that actually helps. It's maybe between 20 and 40% of your actual swing in your gait pattern. If you didn't have arm swinging, you wouldn't be able to run as fast. That's the simplest fact. So you can utilize that. Okay, there's some different arm swinging techniques from postural restoration. And when we do strength conditioning, maybe we can do something with an arm swing as well. We can do a cable row with your arms rotating and pulling backwards and forwards. We can do one arm cable presses. We can do, I can keep on going down the line of how we can use these functional patterns, if you will, in the concept of both postural restoration and strength conditioning. And that's kind of how I blend it all.
And with that training, well, first of all, too, like, would massage be something you do with that guy just to prevent?
Oh, yeah.
Yeah. Okay. So that was the other curious part. 'Cause some people are like, no, I there's the anti-manual crowd out there still that's against manual therapy for whatever reason. But
I mean, at its simplest, right? There's the effects of relaxation, right? Just like I mentioned again, like even if I just said, hey, I'm gonna do some work on your calf, and I was just doing some effleurage, super easy, like he would feel, wow, I feel really relaxed. Thanks so much. Like doesn't have to be targeted. There's no clinical studies. It's not a controlled study, but it's just like, are you more relaxed? Okay, cool. Now you go run again tomorrow because you're literally going to run a half marathon tomorrow.
Yeah.
So the volume adds up, and because of the volume adding up, are there things that happen on a like a blood work level that I can help relax? Mm-hmm. And there you go.
Yeah.
And that happens also in professional sports too. It's not just, for runners, period. That thought process can be applied to, baseball, basketball, football, etc.
Yeah, it's interesting to have been in this field from when I started not a couple years ago, but I guess like 8 years ago now. That's just flying by. But when I came out of school, there was such this like push on like pain science and anti-manual therapy. And I was just watching that. I think it's The Starting Five. It's called on Netflix.
Yep.
Did you see that at all?
Yep. I'm about halfway through it.
Same. There's like such a emphasis on like recovery, massage, physical therapy in there that like these guys swear by to stay healthy. And it's like, okay, we're back to the manual is like works and does something. So it was just interesting to see these guys like LeBron's there, in the morning from like 6 a.m. on game day and like gets like 3 PT sessions before he plays. You're like, Jesus. But he like
that is a thing.
Yeah.
I've worked on individuals in that manner, like literally other athletes, and I have friends, and maybe you do as well, that also operate in the same manner. Maybe not 6 a.m, but pre-game, if you will.
Yeah. And so has PRI changed your thought process too as a strength coach of there's certain things you do or don't do now because of it?
Yes, definitely. I was introduced to PRI a couple years after I started off as a strength coach. So it's kind of hard to say that I did not grow as a practitioner and, just as a strength coach. It's hard to say, did I just grow as a strength coach? But I kind of also grew at the same time as I learned more posture restoration and being a strength coach. So it kind of grew in tandem is kind of what I'm saying. Like my evolution in just all of me as an individual, which I hope, I can say that much at the very least. I hope I grew. So yes, it definitely changed. There are still times, with other athletes that I would 100% still do traditional strength coach things. Just in this past season, we were doing a lot of different velocity based training, gym aware, whatever tech, other tech that may be available. Like we were trying to go for big numbers and big weights. Like that's definitely still a thing. Mm-hmm. The way that we do it has changed. Like we're doing it with split squats. We're doing it with, not so much just bench squat deadlifts. It's not just so much like a meathead thing. It's a little bit more focused. Think of like a mad scientist, but also a strength coach kind of thing. That's kind of what people think of it as nowadays, at least in my circle. Mm-hmm. Because we can be more focused is kind of what I'm saying. And then it's not just velocity-based training, but there's also different things that come with that. So to say that much, how has PRI changed with that? It's like, again, I'm going to go to the same thought process of if you can be more efficient with your, even just from a muscular level, if you can be more efficient with your muscles, why would you not do those techniques prior to moving the big weights? Mm-hmm. It's only going to help. There's things that I might not do if an individual is like on the cusp of, losing a contract. There's things that are probably on the line, and then it might need more consideration because that's a different process altogether from a skills perspective. That's where I'm coming from. From a strength coach, though, I feel pretty safe with the things that I'm doing in the context of here's the exercises that I'm used to using. Here's how I can blend it with these posture restoration techniques, and then combine both of them like a I don't know, I didn't eat breakfast necessarily yet, like a really good meal. Just combine it, whether it's a sandwich or what. Just combine it all together, and then like, wow, this actually makes sense. one thing that I do, I'm kind of like leading into the next question that you have here. One thing that I do a little more of now is I blend it in specific ways. And I've been doing this thought process since maybe 2017 now, but it's become more refined over time. In order to do things on one leg, what muscles do you need? It's not all quad, I'll tell you that. You need all the hip stabilizers. I haven't seen too many people that I try to do like a manual muscle test on and say, wow, your glute med is so strong. It's not really common, if that makes sense. And if it is that strong, that means everything else is weak. And then that is its own problem. So where I'm coming from is if you have hip stabilizers functioning correctly, at your pelvis, you have things above and below that also need to be functioning correctly. So we need obliques above the pelvis, and we need some level of pelvic floor muscles working correctly within and below, or on the side technically. Mm-hmm. So with that being said, how can we help facilitate that? Well, now let's go to posture restoration techniques. I can even, I mentioned the 90-90 hip shift. There's other techniques that help a glute work better, that help a hamstring work better, an adductor work better. Let's use those techniques first, and then go into your one leg RDL. And then that's how you can blend it. Mm-hmm. And then you could also have a tri-set of like, oh, here's a side plank that we can utilize, a side plank variation that uses more internal obliques. And then from there, you kind of like, it just kind of snowballs itself. It's like, wow, I feel good everywhere. It's like, yeah, that's how it's supposed to work.
Mm-hmm. Nice. And are there certain things people can do on is there any catch-alls? Like, I know what used to be and what PRI is kind of was almost branded as in the beginning was, everyone lying on their back with their legs bent to 90-90 and breathing with a balloon. Is that something we still have everyone doing as like a pre-warm-up activity?
So the amount of time, just to address that, the amount of time that I've used a balloon specifically is because an individual has issues with pressure. Mm-hmm. And it might be, well, I don't want to say pelvic floor issue. A bunch of different pelvic floor PTs might get mad at me. And posture restoration pelvic floor PTs. That might be more of like an end stage thing, because if you can challenge yourself with a balloon's pressure, that means you're more towards the end of it in terms of therapy. Other individuals who, look at any coach, this is me speaking specifically to all the strength coaches. If you have a very hoarse voice because all you do is yell all day, you might need some level of balloon breathing to help relax your neck muscles. And I've been there.
Hey, I'm always hoarse.
So that might be a thing. Okay. The other aspect of it is, are there other techniques or movements or exercises that people can be doing to help restore that posture, or any posture in this case? Put it this way, from a pure position perspective, is the only thing that we're going to do for individuals, is it going to only be on their back? I can't imagine a clinical practice where things outside of just PRI, if you are only on your back for the entire session, where that is successful. You need to, at some point, this individual, unless they are in a wheelchair, this person will have to walk out of your facility. And because of that, there are seated techniques, there are side-lying techniques, there are what's called all four or hands and knees techniques, there are what's called standing supported, where your back is on the wall, right? Like you're using the wall as a support, and it's not to train your quads. I'll tell you that much. It's not a wall squat. And then there's also single leg stance and all the different things that come with that from gait. So there's a whole bunch of exercises that can be utilized to restore posture. It's not just like 90-90 with a balloon. I might challenge some individuals to find different things that will challenge them, number one. And then number two, if there are things not working for you, guess what? You should choose something else. Because if it's not working for you, if it was working, it should have worked by now. Mm-hmm. Is a common I say that quite often.
Yeah, and that's a great thing too. That's just how we practice. I'm not a PRI practitioner by any means, but Yeah, it's like the it lines up a lot with the neurodevelopmental model of, we can start on our back, roll to our belly, get up in all fours. You learn to kneel, stand up on furniture, and start walking. We need to do that with people too. So
definitely.
Yeah.
So do all of it is basically what I'm saying, right?
Yeah. Exactly. Start one on and get up into standing. What is the best way for someone to well, actually, let me back up here. PRI is kind of a flexion-based or flexion-biased system, correct? Like we're trying to get people to access flexion more in a way, or spinal flexion?
Sure.
So,
yeah.
As a strength coach, I've seen some different things online with PRI in my past. What is your thought on the Jefferson curl?
So, yeah, I mean, if there's a big Venn diagram of like, here's PRI, here's strength coach, and then like that question, what do you think of the Jefferson curl? Right? It's kind of like...
This just came to me out of nowhere.
Yeah.
Like, you know?
Yeah. So, at its simplest, you are going to be rounding your spine. Like that's its simplest thing there. Now, I don't know if I would do it with load. There's different talks about capacity and this and that. Sure. I would first say you need to just touch your toes without load first. Mm-hmm. I don't know if you would do it with load, but you cannot do it without load. That's kind of sounds contradictory just coming out of my mouth right now, but I've seen people do that as well.
Yep.
Saying it helps them. I'm like, okay, sure. I mean, you could just like sit on the couch and not do anything, and that'll probably help you because you're rounded in your spine. Right? Like that's,
yep.
But you know, using it with load, and I've seen some individuals do it with like crazy amounts of weight, like 225 and 315 and all that. And I'm like, wow, I mean, sure. At its simplest, humans and organisms just literally everywhere, like biologically, there are things that individuals will adapt to. If that is a thing that you need from an adaptation perspective, from a needs analysis perspective, I don't know that I see somebody and I'm like, you know what this person 1000% needs is a weighted toe touch. I don't know if that's a necessity from a neurological perspective, musculoskeletal perspective, from I guess tendon perspective, if we're talking about the back, those things, I don't know if that's 1000% necessary. From a wolf's adaptation perspective, and just like from a pure adaptation, will this person adapt? Like, what is the threshold? Like, how do you know you've attained it? How do you know when you've got there? When you've made it, quote unquote. And that's kind of a tougher discussion because it's like, okay, you touch your toes. That was probably your goal because you haven't touched your toes in like 15 years, 20 years. Let's load it. It's like, I don't really want to load it. That's probably what most people might comment on. Yeah. So that's just, me thinking out loud. I would first want somebody to touch your toes first.
Agreed.
If they want to entertain holding a 5-pound weight, that's probably not going to destroy them. Doing it with 315 over time, that might be more issues than anything else. So
yeah, there's so much data that points to biomechanics don't matter, and load to capacity, and you'll be fine regardless of patterning. And it's like, I don't see that, and I think someone like you can really see like, well, posture, patterning, mobility, they do all matter. And it's just, the more I talk to experts in the field on this, it's like, no, I've been a strength coach for years. Like, would you agree like deadlifting with a neutral spine is still good? Yeah. Or better than...
To answer that part of the, how do you think of flexion with PRI and then integrating it within strength conditioning? I think at its simplest, it's the restoration of flexion. The amount of, athletes I've seen with back pain because of, extensors being on too much. They have a lot of rotation extension issues at the spine, swinging wise, sprinting wise, etc. It's not just hamstring injuries that occur when you sprint. It's like you might have some back stuff happen too. And you translate that also to pitching. There's a whole different line of thought process that comes with that. And then we could talk for another hour about that. But at its simplest, it's the restoration. of flexion, right? So if we have a restoration of flexion, I wouldn't 100% say it's only flexion based. And that's why I'm not saying like, okay, if it's flexion based only, then do a Jefferson curl.
Yep.
So I think from an adaptation perspective, I've loaded some heavy weights on my back as well. And I would tell any other athlete, like, you don't need to load this much. Like you got a contract for a reason. There's no reason for you to load this much on your back, or you're, doing a back squat.
Yeah. So. Well, that's the thing too. Like working with baseball players too, are they someone that really? I've always found baseball players. Some of them want to get after it and things, but at the pro level, do all of them want to load that much and get into the gym every day and do that, or is it?
Yeah. So I mean, it always comes down to what the individual comes, like, how do they get that contract? How do they get noticed?
Yeah.
Is it they're just pure skill set? The thing that I've heard other coaches working in pro sports saying, like, oh, I'm going to use that. That makes sense. At its simplest is like, well, the athlete got here because of their skills. Now let's use weight training and the gym to help them maintain what they have. So just over time, we just know that, at its simplest, you lose power as you get older. And that also applies to when you're going from 18 to 25. Like, if you train no power, you're going to lose something. So let's maintain what you have at the very least so that you can keep the same numbers and you can show people, be like, hey, my swing speed is the same, if not better, from when I was 18 to now I'm 22. And then we can use that thought process to be like, here you go. Like, this is exactly what we're doing. Now, if you do get better, it's like, wow, look, now you're better because of the coaching staff, because of strength conditioning. So we can kind of like have a hand in certain pieces, if you will. So yeah, that's kind of what my thought process is on utilizing these things, not just from a PRI and efficiency perspective, but also strength conditioning.
Yeah. And last questions here. As a PT, a coach, personal trainer, whatever, when should someone look to refer someone to a PRI specialist? Like, what things would somebody be reporting, or, some of these things that like I have a couple cases, I'm like, I think only PRI is going to help this person. What should we be doing there? What should we be looking out for?
So that's a tougher question.
Yeah.
Because, there's at its baseline, if some individuals go through rounds of PT and you get above a certain threshold of capacity, right? Pain's reduced, quality of life gets better. It's kind of hard to say, now you should go to PRI. It's just harder to say that. Because at its simplest, right, you've done things in a certain way and you've done it for 12 sessions with this one person, you've gained trust. I'm not going to say go against that. I'm not going to say use that trust and just put it into somebody else. Hopefully, as everybody kind of grows, this is me being hopeful. You get better as a practitioner, you get better as a clinician, with or without certain modalities or philosophies. And then if there is something that you think cannot be addressed, and this is where I think neurologically, I think it might be beneficial. If something's not working out musculoskeletal wise, if something's not working out orthopedically, as you going through the motions of what your skill set is, and I know several practitioners, and you and I both know that are just specialized, perhaps in I forget the exact name, but different joint manipulations. If those things don't improve, 9 times out of 10, it might be neurologically based. Right? You do the same neck crack every time you see this person every month. It's like, maybe something's going on that I'm not aware of. And then you can refer out, or even just getting a baseline level of posture restoration information and just saying, okay, these patterns is what I'm seeing, but I don't know how to progress afterwards. You don't need to take a bajillion courses like I have, but maybe just take one and be like, I think I see this.
Cool. I appreciate that, man. And is there a good place too? Connor, that works for me, wanted to know, is there a good place for PTs to pick up more information to like get a better baseline understanding of PRI?
Well, of course, it's, in my head, I think it's a pretty straightforward, just observation or just looking up information online on the website. If I said just look it up online, you'll find anything.
Yeah.
The website is actually redone, so it's a lot smoother in the context of how it looks, easier to sign up for certain things. Now, the only part that's difficult is, if you're trying to get more knowledge, what exactly does that mean? Are you trying to like change how your philosophy is? Are you trying to just understand more about PRI in general? I would say take a home course, because then you could take it at your own pace. I think it's about like a 3-week, I could be wrong, 2 or 3 week study at your own pace, if you will, versus just going away for a whole weekend and you have to travel, get hotel, blah, blah, blah. You could just kind of study from your own, at home after work, 1 hour at a time, for example. So it's a little bit easier to digest, and then you could pause, play. That makes it a lot easier. Some of the other areas, there's actually a pretty interesting, there's a PRI Google group. If that's, like not many people know about that. You need to have taken at least one course. So if you take even the home course and then you kind of like sign up for it, etc. It's kind of like back in the day, like people did Facebook groups, but now it's all like spam. Mm-hmm. So that's a really understated thing is, people use this as like hey, is there a practitioner out in San Francisco or Des Moines, Iowa? I don't know why I thought of that first, but it's just like, is there somebody somewhere? Because all the practitioners, say in Boston, like we're listed, but there might be somebody elsewhere. Like we need somebody in New Mexico. Is anybody out there? Yeah. And they're not listed, but they've taken like 10 courses. Mm-hmm. Then they'll be like, hey, I'm here. Right. Yeah. So that's an easy way to just like refer out. Yeah. And then also like, I have a question about this person. They've had issues from surgeries and this and that. What do you guys think I should do? And then literally like the craziest answers can happen in a good way from very, very smart practitioners and even faculty from the Institute. They chime in, which is pretty awesome to say the least. That's
cool. And Miguel, just to wrap things up here, is there anything else you wanted to add on any of this stuff?
Honestly, this has probably been one of the better podcasts that I've been on regarding at least even just posture restoration. Not for sure. And even just how smooth, like this is props to you. Like even doing the 1% of the homework. And, I can obviously see this is not like I just decided to do a podcast yesterday thing. Like I see your setup, like this is, much props to you. This is really, really been well done.
Thanks, man. Appreciate it.
Yeah, for sure. And it was just like pretty easy to talk. Like even if you knew basically how to ask these questions is kind of what I'm saying.
I've been doing this for 4 years now, so I'm trying to get it, keep getting better
more
at this
refined.
Skill and more. Yeah, I keep refining it. So I appreciate the acknowledgement, though.
For
that
sure,
means a lot. And Miguel, where can people find you and get a hold of you?
So on all social media, I am Miggsy Bogues, MIGGSY BOGUES. That's not my real last name, but I took it anyway for social media purposes. And this whole route of everybody kind of changing their names to like their actual this and that. Like I just kept the same username for literally years, so I don't really care about that part. But I literally have that everywhere online. I also have a website, MiguelAragoncillo.com. I don't update that as much, but I should. Okay.
Is it easiest to reach out to you on like Instagram or something?
Yeah.
Yeah. Cool. Awesome, man. Well, again, thank you for your time, and I appreciate having you on. And next we'll have to we've had Greg on, Greg Robbins. We've had you. Is there any chance we can get the Godfather of Baseball performance on with Eric Cressy?
I mean, it's certainly possible. I'm sure somewhere down the line he could find some time, despite owning a bajillion businesses and working with the Yankees. So
yeah, yeah, that's crazy. But again, thank you, man, and I hope you all enjoyed this. And if you have questions for him as well, you can forward them through us, and we'll get them across to him. So thank you all for listening.
"84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECTfitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.